You might be wondering whether you should be starting on alternative treatment or complementary medicine while you're seeing the fertility specialist. What's the good points and bad points about this? Welcome to Fertile Minds. I'm Dr. Peter Leung, obstetrician and gynecologist, fertility specialist and endoscopic surgeon working in IVFAustralia. In today's talk, I'd like to discuss some of these issues with you. Let's talk about alternative medicine or complementary medicine. Now, know in your depending on your ethnic background, it is not uncommon for a couple wondering whether they should actually seeking alternative therapy or complementary medicine therapy, or whether they should actually go and see a fertility specialist where they are going through a more high-tech IVF treatment. Often than not, people will be struggling between these two choices and wondering whether one is better than the other, or whether they should actually consider both starting at the same time. In the Western medicine type of treatment, such as the use of IVF technology, we are often very heavily based on technological advancement as well as evidence-based treatment. That means all the data generated through the treatment will be analyzed, through scientific means, and all the recommendation the doctors put to you has to be put through the test of laboratory process or clinical trials. On the other hand, complementary medicine or alternative medicine is often based on the different ethics or principles, and so these may not be thoroughly evaluated either scientifically or through laboratory means in order to be a reproducible outcome. So the common type of alternative therapy or complementary medicine may involve the use of oral supplementation of either herbs or micronutrients, the consideration of using acupunctures or other means of acupressure, or the thinking about having other means of supplementary treatment during the IVF treatment cycle itself. Overall, if you're considering the micronutrient or the hormonal type of supplementation, there's unfortunately lack of scientific evidence to say that this is going to be beneficial, for overall improving infertility or the improvement of IVF outcome. This is obviously a difficult field to study, as there's a limited amount of literature available for analysis, and some of the information we can gather through those clinical trials are also very conflicting. Nevertheless, there is also a theoretical risk being imposed when you're starting on those alternative or complementary therapy. Unfortunately, because of the lack of standardization of these treatment or the medications being put on the patients, we don't understand sometimes how things work, or whether if there was a complication arise, then whether these has any role to play. So often your fertility specialist would discuss with you the good points and bad points about consideration of starting on these alternative therapy, as well as the potential side effects or outcome that may be arised. Most of the fertility specialists will perhaps suggest the patients to refrain from starting those alternative or complementary treatment while they are starting on IVF journey. If you're considering having acupuncture or acupressure, this has also been studied very thoroughly in the Western medicine. In fact, the recent publication in Australia, where IVFAustralia has also been part of the clinical study group, it has demonstrated that unfortunately the acupuncture does not improve in terms of IVF outcome. It may be making you feel better psychologically or emotionally, but at the moment we don't have any evidence to say that it's going to be improving the pregnancy chances. So overall, we would suggest couple that if they are happy to consider acupuncture or acupressure as a means of stabilizing their mood or improving their general psychological well-being, I think overall it is still safe to have those alternative treatment regimen available. But if you're mainly concerned is about the pregnancy outcome or the chance of achieving a live birth, then unfortunately we don't have any data to back that up. So some of the common hormone supplementation, apart from the herbal treatment that people has used, will be medications such as the use of CoQ10, DHEA, or male hormone supplementation, for example, as well as growth hormone. Those are what we call adjuvant therapy, and usually is in couples that have undergone multiple courses of IVF treatment, either unable to generate sufficient good quality embryos, or they have very poor oocyte quality or poor oocyte number, that they will be contemplating using these medications. Unfortunately, there are still lots of controversy surrounding the use of these medication, in a sense that it may or may not be able to improve the oocyte response or the quality of the embryo. So overall, we would not usually recommend these treatments unless it is being discussed thoroughly with your fertility specialist, and then the doctors will be able to dissect the good points and bad points about using these supplementary medication and what the possible side effects have been generated from it. So this is one of the common things that we get asked all the time, is whether we should actually start on taking vitamin supplements before starting on IVF journey or fertility treatments. Overall, there's a misconception that these vitamins or supplements is going to improve your chance of a successful pregnancy through ART treatments. Unfortunately, this may not be the case. These vitamins, the whole aim is actually to improve the healthiness of the child while you're having a pregnancy. So these would include the folic acid supplementation, where we would be maintaining the brain as well as the neural chip formation of the baby, as well as there would be content such as iron as well as iodine, so as to improve on the iron deficiency as well as iodine deficiency, which is fairly common in Australian women. That is why your doctors would usually recommend you to start on these pre-pregnancy vitamin supplementation, in the hope that if the pregnancy do happens, then you are in the best shape, in the best position to deliver a healthy baby. So hopefully in today's talk I've given you some background information considering whether these should be starting or whether it's going to be helpful to your fertility treatment. So my recommendation is actually try to be keeping an open mind, talk to your fertility specialist about your need, as well as the plan that you are going to go through, including what possible alternative treatment or complementary medicine treatment you are planning towards, so that the fertility specialist will be able to give you a more comprehensive picture and recommendation about whether you should actually attempt those treatments. Thanks for watching, and if you have any questions or concerns, feel free to leave a comment on the comment below. And if you want to hear more about this content, as well as looking at more information about fertility treatment, feel free to hit the subscribe button.